Ladies and gentlemen, welcome back and thank you for watching the HealthTech Summit 2022. Now, after the insights that Mr. Zahid Butt shared with us, we now have another case study about aligning goals and change management by Dr. K. Naeem. So Dr. K. Nadeem is going to be talking about aligning goals and change management. Over to you, Dr. K. Nadeem.
Thank you very much. I want to say good afternoon to everyone at the HealthTech 2022 forum. Certainly appreciate giving me the opportunity to provide this presentation at such a wonderful venue. Unfortunately, it's remote, and maybe I should say fortunately it's remote because of the technology that we have today, allowing us to have such wonderful forums over the world. So I want to thank Mr. Kanwal Masroor for helping coordinate all of this, and of course my own colleague and CIO, Mr. Shaukat Ali Khan, who invited me to speak here. Very excited to see several of my own colleagues, other colleagues from Aga Khan University at this forum. So and as well as one of the really big partners for Aga Khan University, colleagues from Meditech. So very excited to be here. And really enjoyed watching Dr. Zahid Butt's presentation. So thank you, Zahid, for that. So getting into my talk, I'll try to go quickly as possible. There's quite a bit of material, but anytime we start a project, specifically when we talk about technology-related projects in the healthcare spectrum, one of the biggest elements of having success is to align the goals. What is it that we're all trying to do with this new technology? I think technology, having new technology for the sake of having new technology is not good enough. You don't just want the shiniest tool, the shiniest new car. That's nice, but what does it actually do? Does it drive faster? Does it get you to where you need to go? Where is it that you need to go? Are the tires and the suspension system going to handle all of the holes inside the roads, or are you going to get stuck in the middle of the way? So when it comes to healthcare, I think technology has had an awkward introduction. And if you look at healthcare now across the world, not just in Pakistan and in Asia and in East Africa, but even going into the West, it is still kind of an awkward introduction. And because a lot of times the technology and the purpose of it are not aligned properly. So the focus of this topic is really aligning goals and change management, because I think some of those basics do apply. So when we talk about this presentation, hopefully through this, you'll understand what I mean by aligning goals. I really promoted a concept of benefits-driven system implementation. I have been, over the past decade, helping other hospital systems with their electronic health record implementation and ancillary technologies associated with such a large project. But really understanding the benefits that you're trying to accomplish is key to ultimate success. So understanding the difference between invention and innovation, so we'll talk about that, applying value to the change that you're trying to make happen, and of course, effective change management, how that applies, and getting stakeholder buy-in. So the bottom line that I like to begin with any talk is for everyone to understand that software is a tool, and software is becoming more and more like hardware. It truly is having a direct impact on how well you can perform whatever it is that you're trying to perform. Just using it, just saying I used the system, therefore I had success, is a fallacy. You don't want to make the wrong assumption that by using something, you had success. That's not good enough. Really, you have to find what are those goals by using that. What is it that you're trying to do? So if it's a tool, then using the system is not good enough. It's what is the tool trying to build? What is the tool trying to solve? And that is the key. But who decides what that is? Who decides what those goals are? What is it that the purpose of this tool is? So when we talk about the relationship between our technical colleagues and our clinical colleagues, specifically in the healthcare spectrum, we would like to see our IT staff as the designers, as the builders. Absolutely, they are the ones putting this, if we talk about a structure, building together. But then your clinical providers, whether it's physicians, nurses, pharmacy, radiology, etc., they must contribute to the purpose of the design. You don't just want to have a building for the sake of having a building. As I said earlier, you need to have purpose to this building. What is it that we're trying to cover? What is it that we're trying to protect? And what is it that we're trying to do inside of this building and keep safe? So that purpose must be known clearly to the designers and the builders. Otherwise, you can say, well, I want a building, and they build it, and you realize the door is on the other side, and the clinicians have to walk all the way around the building to get to that door. How inconvenient is that? Now, the builders might say, well, you told us we needed a door, so we put in a door, but it's on the wrong side of the building. And this is a very simple analogy to how software has been introduced in the healthcare world. A lot of times we say, well, it meets the specification, but the specification does not meet the ergonomics of a visual and clinical workflow. And that is very important. And so the only way you're going to know that is you get the end user involved. Have the end user involved in the process. So the ultimate goal of any software within the healthcare spectrum, the ultimate goal is having better patient care. You cannot go live with a system and have worse patient care. All else being equal, yes, we're faster, our revenue cycle's better, all of those things are nice, but if you don't have better patient care, you've missed the entire point. So this is a very crucial element. That software is a tool to allow you to have better patient care. So when we talk about projects of implementing softwares and the design of them and getting stakeholders involved, you really have two big stakeholders. You'll have your executives and the non-clinical elements, right? So these are folks who, I don't practice medicine, but I help others who do practice better because I either install or maintain that tool that they use. And so my concern and the concern of my executives in the institution will always be, well, did you get it on time? Because that's the first question they ask. What time? When's the go live? They're always focused on time. They're always focused on budget. And they're always focused on return on investment. And that is their job. They're supposed to focus on these things. So if they're focusing on these things, that means they're doing a good job, because that is their job. They're not the clinical providers. They're not the ones seeing patients. Right? So at the end of the day, we have our executives and our IT. And if that is the only goal you have of any software, then you're missing that point that I mentioned earlier. But then when you get the end users involved, the clinicians, whether it's physicians or nurses, or again, like I mentioned, pharmacy, or could be even your dietary staff, is it safe? That's the number one question anyone in the healthcare world will ask. I'm going to start this new application or new software system. Is it safe? Is it going to cause problems? Is it going to cause more confusion to the provider because there's too much data? And now I'm getting confused because now I have, instead of 3 factors to make a decision, I have 20. So how do I decide? Is it efficient? Is it slowing me down because now there's extra factors I need to take into consideration and the software is not helping putting them together in a very meaningful way for me? So it has to make clinical sense. And at the end of the day, there is a gap, as you can see. So when we go live with this software system, let's say we go live on time, on budget, you're getting an ROI, but none of the things on the right side of the screen occur. It's not safe. It actually causes more patient death. Now, your executives, and this is probably an extreme example, and I know this doesn't happen, we wouldn't let it. But again, to make the point that from an executive, and I'm just picking on it. I'm sorry? Is someone asking a question or speaking? My apologies. No, okay, I'll just continue then. So as I was mentioning, the gap here is that the executives or IT might say, well, it's a success. The software was implemented. We mission accomplished, right? But at the end of the day, when you don't tie in the factors on the right, this is what causes a mismatch of expectations, and I'll get into that in a moment. But ultimately, your clinicians might say, no, it wasn't a success. And I have seen it both ways. I have seen softwares go live where the physicians and the nurses, everybody's really happy, but it's not on time. It wasn't on budget. And you're not getting any ROI. Yes, I have seen that happen. And I've seen the opposite happen as well. Probably the opposite is more true. In other words, most of the time, the focus is about the budget, it's about the ROI, and that is the determining factor of success. The clinical parts are usually put on the wayside. They're not even discussed, which is really alarming to me, but they're not even discussed. But ultimately, I have seen it both ways. So we need to bridge this gap. And it's very important. So how do we bridge this gap? And this is how you align goals. The goals must be aligned. So in this process of aligning goals, we call this a benefits-driven system implementation. Because at the end of the day, those are the benefits that are going to drive why you're implementing this software. So these aligned goals could be, the executives are going to say, well, we're spending a lot of money on transcription costs. As a private practitioner, whether you have insurance or your patients have insurance or they don't, you might say, well, I'm private practice. I want to increase the reimbursement or increase my own revenue. So I understand you want to reduce your costs, but I also need to do something. What can we do together to make this happen? Let's have voice recognition and let's have documentation templates, provider doc templates. So let's have templates that has key criteria, metrics that will enable not only the transcription costs to decrease because we're catching those quality and safety metrics that the hospital so much needs, but also my own practice is benefiting from this because I'm able to capture certain metrics in this template that we're using. If I have delayed, canceled, or bumped operating room cases in the hospital system, that costs money because you have the entire team ready and then the case is canceled because the patient isn't clinically or medically optimized. And so therefore the patient will not tolerate the procedure. So out of safety concerns, you cancel the procedure. This costs money to the hospital because you had everybody ready. You're paying for them to do nothing, right? You're paying them to get ready to do nothing because now the case was canceled. On the clinical side, of course, we want to decrease the risks of any surgery. How do we do that? Well, why don't we have pre-operative risk stratification workflows where before surgery, we can identify the patients at high risk and then optimize them before surgery so that the surgery will not be canceled. And this has been done in places such as that I visited, such as Cleveland Clinic in the US, where they've been doing this for almost 2 decades now, where they have a really nice pre-operative risk stratification process, which almost eliminates urgent cancellations of their operating rooms. And you can imagine when you're getting patients from all over the region, this is very important to do. Again, your executives might say, well, we want to reduce costs related to medication errors. I think everybody wants to reduce medication errors for the sake of medication errors. But of course, the cost assigned to that goes high too. Why? Well, it's not just the cost to the hospital. It really is the cost to the patient. Imagine the patient taking a medicine when no one told him to stop taking it. So they kept taking it. And now they're coming back to the hospital because of a medication adverse effect. Because when they came in, the last time someone prescribed a beta blocker, they were already taking a beta blocker, and now they're coming into the hospital with bradycardia, low heart rate. And so this is an adverse drug event. It could have been prevented. So we want to make sure that medication reconciliation process is streamlined to have a reduction in those adverse drug effects. And of course, you know, our administrative teams will always talk about, yes, we got it in on time, we got it in on budget. But of course, for a clinician, it might be the rounding time. When we talk about time, it might be, well, how is this helping me with my daily rounding? Am I having to spend more time in front of this chart? Whether before it was paper, now it's electronic, or less time. So we want to improve utilization of resources, and our clinical providers are part of your resources, right? So everything is a resource, humans are a resource, and therefore we want to improve utilization of all. So aligning goals is quite important. So now that we said, okay, we have our goals aligned, let's go ahead and try some new things. This concept of trying new things, otherwise referred to as innovation, is really difficult in healthcare. How many hospitals have rounded in a different fashion? You know, how many, do you understand the history of a progress note? How far does that go? Or that history and physical document, or that discharge summary? To be quite honest, it goes back decades. It hasn't innovated. We haven't innovated a lot in healthcare, not how physicians and nurses document, but it is very difficult. So when new technology comes in, let's just ask, what are we trying to do? If you have a patient-centered app that informs the patient about how long the wait times are in the emergency department, but it doesn't actually improve the wait times, what have you done? It's hurry up, and then you go and wait. So what was the point of that type of an app? So is your app or is your software, is it patient-centered? That's very important. We must keep the patient at the center of all things. Technology, sometimes the established technology is better than new technology. Why? Comfort. You've been using the established technology, you're comfortable with it, you understand it. Maybe you and your team have even participated in the past of deploying the current system you have. So you will have automatic resistance to new innovative ideas because your stakeholders are so comfortable with what they have. And of course, the business model itself. In healthcare, there's a bit of a conundrum that you want to be more efficient. At the end of the day, it's not about efficiency. Really, like I said, it's about the patient. You want them to be more healthy. Well, healthy patients don't come back to what you want. And the bottom line is, of course, yes, but then that impacts our business model. How do we keep them well? So you find a lot of hospitals, inpatient hospitals, branching out into the outpatient and outreach areas more and more and more. Why? Because we want our patients to stay healthy and therefore not come into the hospital unless it's a true emergency. So, these factors do put a burden on innovators within the technology spectrum that are trying to innovate things within the healthcare world. And we also need to demystify innovation. And so at the end of the day, innovations are not inventions. Apple is a good example of this, your iPhone. They did not invent the phone. They didn't invent the MP3 player. They did not even invent touch screens, but they put things together that now you have a smartphone, right? And so it was an innovation of things that already existed. At the end of the day, we're not inventing healthcare. You're not going to invent a new type of doctor, a new type of nurse, a new type of, when you have technology come in, but you may innovate it and make it better. Radical change is not always required. We don't have to change everything. Like I said, the progress note, the history and physical document, they've been around for generations, decades, maybe I would even say over 100 years. So you don't have to have radical change, but that documentation template, imagine having half of the demographic information that you want to have in your documentation auto-populate because the software does it for you. That's innovation. And it's a small step, but it can have a profound impact on that clinical provider, because not only is the data accurate, but it saved them time from having to populate that document. The system did it for them. Apply an approach for radical innovation. So if you do want to have something radical that you want to do, make sure you have a very structured approach. Radical deployment in a healthcare environment is not always a good thing, right? Because the downside is you could harm patients. So we want to make sure it's a structured approach. Think big, but plan for it. And then, of course, the goal is always improvement. Focus on improvement. It's not about innovation. Like I said, it's not about getting that shiny new vehicle. We don't care about the shiny new vehicle as long as it works and it gets us to where we need to go. That is a more important element of innovation. So having a structured approach to innovation, don't worry about inventing things. We don't need to invent healthcare. We just need to innovate on how to deploy healthcare better. So value-driven process change. So anything that you're going to change must give a value to it. Don't just change it for the sake of change. Apply it. There must be a value that you will accommodate or that you will receive when the change is done. So have a structured approach. Have a vision. What is it that you're trying to do? Understand your current state. How are we doing this now? What are we doing now? What are we accomplishing now? Generate ideas. How do we generate ideas? Have the people involved that do those things tell you, I have an idea, because I can guarantee when they're going through their day-to-day work, they're probably thinking, oh gosh, why are we doing it this way? If we had done it this way, it might be better. Get ideas from them. They're there. We just need to generate them and capture them. And then prioritize for benefit yield. Which of those ideas is going to give us the biggest yield of benefit? And then you say, okay, that one is, let's make sure we do that one first. And then you start incorporating that into your future state and you realize those benefits. So have a structured approach. So I'm going to go through quickly in the interest of time. What is change management? So we talked about aligning your goals. We talked about innovation and how innovation in healthcare is so challenging and how we can diminish some of those challenges. Okay, now we're doing these things. What's the impact on the people? Remember, change management is the practice and process of supporting people through the change. It's not about the change itself. It's about the people that are doing the change. It's always about the human element. Remember, at the end of every computer, at the end of my computer, there's a human being. So that might be debatable if you ask some people if I'm human or not, but there is a human being at the end of every computer. So focus on that. Don't ignore the most important element of this exchange, which is the human element. So focusing on helping employees manage that disruption during the change is very important. And I'll talk about where is the disruption the most. It's called the transition state, and I'll describe it in a moment. But change management is different than project management, because project management is about getting it on time, getting it on budget, making sure you have adequate resources to make sure the project is successful. But if you ignore the end users and the people that are actually that it's impacting, your most successful project on paper can have the worst outcome in reality. So this is a very important element we should all keep in mind as we're going through these massive changes within the healthcare world, as we see now with new technologies being deployed. Many of us have experienced what type of changes with the COVID pandemic has led to. We have tried wonderful things, both at AKU and other institutions, and many of them have worked. Some of those things have not worked. And it's because we didn't provide enough support and we didn't help our employees enough to understand the impact of many of those changes. So when we're talking about designing digital healthcare systems, right? When we get into this, we must understand that there's an expectation mismatch because you have different stakeholders. And if you have an expectation mismatch, then you will have a definition of success mismatch. You go and survey that hospital that just deployed that new application or the new software, whether it's an electronic health record or it's just an ancillary software on the side, interview them, ask them, what do you think? And depending on who you ask, you will get a different response because different stakeholders have different expectations. And the worst thing that happens in projects is we don't ask them in advance of the project. What are you expecting of this? What would you like to see improve? So beware of conflicting expectations. Somebody might say, I want to be less busy. Well, if you ask the hospital administrator, they might say, no, we want to be more busy. So beware of those conflicting expectations. Otherwise, you'll have a different opinion of success when the system goes live. And one of the things that has come up in recent times, and now there's an entire field being developed, is theoretical understanding of work versus practical ergonomics. I kind of highlighted this just briefly earlier, is that level of interaction of me or yourself or any human being in front of a computer or a smartphone device or really any system, that interaction itself is a science. And it's very important to understand. In other words, if I'm, if you look at the ergonomics of where things are positioned on the screen, if I'm answering questions here, but the enter button is all the way at the top left, visually, that doesn't make any sense. I'm all the way here, the enter button should be also here. Why is it all the way over there? Because now I gotta look for it. And that looking for it takes mental stress, it takes visual stress, and it adds to confusion because you're looking for something so mundane, you're just looking for a button. And so that human-computer interaction is an entire field that's being developed. I think we must study this more and at least appreciate this when we're deploying our own digital healthcare systems. So understand that ergonomics has a profound role on the user's efficiency and the ability of that human being, not about the computer, it's about the human being, that change management, impact on them. So that's very key. And of course, how do we accomplish this? Test. You have to test. They must be tested in a user-centric approach. It cannot be tested in some silo in a digital lab. It has to be tested in the real environment. So that is key to getting the ergonomic feedback, because you can say, well, we have the door, we have the windows to the building. Yeah, but the door is on the wrong side, the window's on the wrong side. The ergonomics is the problem. So that is a big element that we have to take into account. So change management challenges in healthcare. Clinical staff, remember, they view the work they do as a vocation. Yes, it's my job, but it's also something that I have a passion for. So I'm going to just go quickly here. So there's a historical, suspicion of physicians and nurses to admit non-physicians and nurses. We know this. Let's make sure we, don't ignore that element. Employees feel strong ownership in existing methodologies. So you have to get their buy-in because they will defend the way they're doing things now because they have so much comfort in it. So we have to have a systematic plan for accomplishing success in change with workflow disruptions, staff engagement, task delegation, preparing for any potential setbacks, and of course, getting those benchmarks properly set and tracking the progress. So there's a theory of change that's more popular. There's many theories of change, of course, but the one that's most popular in the healthcare world is John Kotter. He published this back in the mid-60s, but management, he says, is focused on creating order through processes, right? They'll create a deadline. But leadership is really focused on creating change through a vision. So leaders create visions, and that's what I'm asking all of us to do, is have that vision, participate in the creation of that vision. Very quickly, when we talk about change management, what is the part that affects staff during the change? As you have your people, you have your process, you have your technology. It's that transition state, right? It's that during the change, what's happening to me in my work, if you do not accommodate for that transition state, you will have many surprises and you will have a lot of confusion. And that transition state could last a week, could last a day, it could last a month, and it could last a year. So understanding your transition state is very important to successful change management. When we talk about change management versus a implementation of any kind of software system without change management, you can see the difference. Without it, you're just focusing on the software. With it, you're focusing on the operational and clinical elements. Modular focus versus overall process improvement. Re-automation of old systems versus transforming those old systems to do new things. Again, innovation comes into play. Your culture is having not much use of clinicians. You don't ask physicians, you don't ask the nurses. You have your IT staff doing its own thing on the side. No, that's the old way of doing things. Effective change management engages those end users, engages those providers. So that way you have effective change management. Remember, the health information technology value map, HIT value map. You may have seen this before. It's a nice Venn diagram. Again, people, process, technology. Change management applies to people, and the process implementation has to do with technology and how the process has now changed due to the new technology coming in. You have to enable your people. They have to feel empowered to want to participate on something that will impact their own work. So why are we going to do all of this? Because of that vision. That vision of shared benefits and values is so important, and that'll motivate all of us to get this done. So again, I'll go through this very quickly. Kotter's 8 steps process for leading change: creating a sense of urgency, building a guiding coalition, strategic vision, having a volunteer army. In other words, get people to work with you, removing barriers, make them feel enabled, that they're empowered, short-term wins, track that progress, sustain the acceleration, align with a new vision if you have to. There's nothing wrong with that. People change vision midstream all the time. It's okay. And then, of course, institute that change to make sure you have long-term support. The end, and I'll go one more slide and I'm done, but the stakeholder engagement is crucial at every step of the way. And just to kind of finish this, to give you an idea of what I mean by stakeholder engagement, here's somebody wanted a swing. They said, I want a tree swing. Well, here's what the project sponsor put together. Then in the project request, the tree swing would look like this. As you can imagine, there's a rope right in the middle. You can't even sit on the board. The senior analyst would design it like this. In my past, I was also myself in IT. I'm a physician now. I'm a CMIO at AKU now. Very happy to and blessed to be here. But I was a senior analyst at US Airways in the IT world, and I would have done something like this in my past. This is what the programmers did. Okay, you have the swing, but where is it going to go? It's just going to hit the tree. This is what they actually installed, right? They said, just cut the tree, put the swing in, we'll add in some support. But at the end of the day, this is what the user wanted. They wanted a tire swing. So getting stakeholders, getting end users engaged, involved in the process is key to success, because we talk about benefits-driven system implementation. Without end user engagement, your outcomes will be unpredictable. So just keep that in mind. And that is the closing of my talk. Thank you so much for allowing me to speak at this exciting forum, and I wish you all the best. Thank you very much.